The Bill and Melinda Gates Foundation has committed more than $350 million for the development of diagnostics, therapeutics, and vaccines in the fight against the coronavirus. Earlier today, I asked Bill Gates what he makes of the results coming out from those early vaccine trials.
We don't know if these vaccines will work. We don't know if they'll work to avoid deaths. We don't know if they'll work to avoid transmission. That's why we're working on so many first-generation vaccines.
How do we know if these vaccines are working?
And you'd like it to be very safe in all the populations that you indicate it for, no side effects. And then you'd like it to avoid the individual who gets the vaccine getting sick.
Where are we in terms of a rapid diagnostic test? You've talked about this a lot. It would be a test that is like an in-home pregnancy test. Where are those tests?
In the next 2 to 4 months, some of those tests will get approved. Now, they won't be as accurate as the PCR, which is a molecular test. And so over the next few months, we have to up PCR capacity. We have to get results back in 24 hours. We need both. And the lag times that we have today are completely unacceptable. It's making most much worthless.
The president said just this weekend that the U.S. has the lowest mortality rate in the world. Is that factually correct?
Not at all, not even close. I mean, by almost every measure, the U.S. is one of the worst.
Why are we one of the worst?
We actually had criteria for opening up that said you had to have cases declining, and we opened up with cases increasing.
We have schools all in the midst of this decision about how to get kids safely back into the classroom or whether to learn totally online. How can we do it safely?
The big challenge here is how to get the teachers and the staff in and to avoid those kids being a source of infection as they go back into their households. This next academic year does hang in the balance on top of the learning deficits we have coming out of last year. So I'd put that after the deaths as the next biggest costs.
One of our viewers texted us this question. His name is Eric. He's actually from Washington State, where you are, and he asked, would you send your children to public school in this current situation?
If the school is being careful, then yes.
Now, if they live in a multi-generational household, where you have old people that they're exposed to, you have to look how hard would it be for you to reduce the, grandparents' exposure to those kids. We do need to remember it's mostly the transmission into the older people that drives these, really horrific deaths per day.
Bill Gates, thank you so much for joining us and for all of the information. We appreciate it.
You bet. Thank you.
And you can see more of our interview online at cbsnews.com, including Gates's response to a debunked claim that he wants to use a vaccine to implant microchip.
Well, unfortunately, we have a lot of young people who are infected, and over the next month or two, a lot of those infections will get up into older people, which is where you have the very high risk of death. And so it's kind of a race. The innovations in therapeutics are reducing the death rate, while this infection surge, which is really unique to the U.S., will get into the older population and drive that death rate up.
Several months ago, you said we need a consistent nationwide approach to shutting down. And you said back then that if it didn't happen, it would be a recipe for disaster. Do you think we're witnessing that disaster now?
Well, there's a lot of things we can go back, and say, why wasn't there a federal testing plan? Why didn't we get the turnaround on the testing down? Terrible situation.
I mean, I mentioned the mortality rate, infections skyrocketing, hospitalizations, pushing hospitals to the brink in Florida, Texas, Arizona. What needs to be done immediately?
Well, some of the policies were a mistake. Opening up bars the economic benefit versus the infection risk of a lot of activities like that made it a mistake. And so now in most of the US, we need to absolutely avoid those things. We need to distance, we need to use masks. We've seen that in Europe, they had the dramatic fall off. It didn't spread into the other communities, and that's because their leadership communicated with a clear voice. Their scientists were encouraged to go on TV instead of banned. And so, the population benefited. The death rate in those countries has gone down very dramatically.
Do you think that because Dr. Fauci has been prohibited from appearing on programs like ours, that has hurt the public health message?
Well, just the idea that the CDC isn't being heard from and that Fauci's being limited, you never would have predicted that. It kind of, it is really unexpected that you wouldn't let the experts share. Dr. Fauci has been able through a variety of vehicles to get some of his thoughts out. It's really the CDC that's been muzzled to a dramatic degree that's holding us back from getting the benefit of their expertise as well.
Mm-hmm. I'm going to turn now to the race for a cure. We've seen a lot of promising news this week on the vaccine front. What do you make of the results from AstraZeneca and Moderna?
Well, it's very hard to characterize complex scientific things in a sort of simple to understand format. We don't know if these vaccines will work. We don't know if they'll work to avoid deaths. We don't know if they'll work to avoid transmission. That's why we're working on so many first-generation vaccines and a whole bunch of second-generation vaccines that, although they'll take more time, they are more likely to be extremely effective. It's great the U.S. government has been willing to fund vaccine manufacturers. Our foundation is partnered with them on that. That's something in my regular phone calls with Dr. Fauci, we update each other on, okay, how are we working with various companies? Which ones do we think we need to add to the mix there? What is the scalability going to be so that not just the US, but the entire world gets the vaccine? So yes, I am very hopeful in innovations in both therapeutics and vaccines. The advanced therapeutics will come first, but in 2021, probably in the first half, we're going to get some good vaccine tools, and that'll be a big milestone. The bad news, of course, when we have many cases, is good news for the trials in that they may accumulate events faster than they would have otherwise. But there'll be a lot of uncertainty about how good these vaccines are. The first generation, they said a 50% effectiveness, and they won't know the duration there. So these are going to be likely partial solutions that will improve over time. And so it's too bad, people think that just that phase 3 approval will be the end of the epidemic.
Well, I want to ask you, you mentioned side effects. The side effects for the Moderna vaccine sound concerning. We looked. After the second dose, at least 80% of participants experienced a systemic side effect, ranging from severe chills to fevers. So, are these vaccines safe?
Well, the FDA, not being pressured, will look hard at that. The FDA is the gold standard of regulators, and their current guidance on this, if they stick with that, is very, very appropriate. And the side effects were not super severe. That is, it didn't cause permanent health problems for the things there. Moderna did have to go with a fairly high dose, and so to get the antibodies. Some of the other vaccines are able to go with lower doses to get responses that are pretty high, including the J&J and the Pfizer. And so there's a lot of characteristics of these vaccines. It's great that we have multiple of them that are
Bill,
going out there. And yes, I think
you know the data
US
better than I do.
government-
But Bill, the data showed that everybody with a high dose had a side effect.
Yeah, but some of that is not dramatic, where it's just super painful. But yes, we need to make sure there's not severe side effects. The FDA, I think, will do a good job of that, despite the pressure.
How many doses of the vaccine will we need?
Well, none of the vaccines at this point appear like they'll work with a single dose. That was the hope at the very beginning. Maybe one of them, particularly in the second generation, won't surprise us. We hope just 2, although in the elderly, sometimes it takes more. And so making sure we have lots of elderly people in the trial will give us that data.
You've said some more than 7 billion doses. That's what we'll need.
Well, if what you're trying to do is block all the transmission, then you need to get 70–80% coverage on a global basis. So that it's unbelievably big numbers.
I mean, you're talking about a global vaccination program without a vaccine that hasn't been fully developed yet, and a massive scaling up of how to produce one or several vaccines. I mean, it's mind-boggling to think about this effort.
But the private companies have stepped up. The science has been advanced. The U.S. funds biological research more than any other country. We've stepped up to fund these vaccine manufacturers. The plants are being worked out now. In 2021, there's a good chance this can get done, and because this is about the billions that we need to spend to save trillions and avoid all those deaths.
But who's going to get the vaccine first?
That's in discussion. Clearly, the U.S., by funding factories in the U.S., will get priority. But if we can have other factories, and this is where the U.S. government's traditional generosity in global health will be needed, our foundation will be needed, other countries, we want to make sure that we don't have people dying just because they can't afford to have access to the vaccine. And so that speaks to the top priority of our foundation. And there's good discussions going underway. The U.S. in this next relief bill may put 1% of it to make sure we stop the pandemic in the entire world, and then that'll draw other countries into that effort.
I want to ask you about today, the government support, taxpayer money that's going towards vaccine development. Today, we learned Pfizer is going to get nearly $2 billion, Moderna receiving $438 million in taxpayer money. And yet both companies have said they will not sell the vaccine at cost. They're going to make a profit on it. Should pharmaceutical companies profit off this vaccine research that taxpayers have helped fund?
Well, the Pfizer case is more of a procurement agreement than an R&D funding agreement. AstraZeneca, Johnson & Johnson have said they're going to use a non-profit construct. The exact contracts that were negotiated, I don't have access to. But yes, you'd want to balance the fact who's taking the risk and who gets the benefit of those things. It's fantastic that the research is being funded, and I hope those agreements in terms of pricing and access are very strong.
I mean, we heard from the HHS secretary say today that the vaccine will be free for Americans, or affordable. So that means the government will help purchase it from companies that are making a profit off of that we helped fund the research for. Do you see any problem with that?
Well, some of the vaccines are being done by companies on a non-profit basis. A few have decided otherwise. And so if you have equivalent vaccines, the one that's the cheapest will be the one that we go with. And we may have, many choices here that some of which look like, the production costs will be quite low. So I do honestly think both in therapeutics and in vaccines we'll end up that it'll be a very clear deal, what should be purchased, and that'll be worked out. Whether people second guess the early buyer contracts, that's not really the key issue. We will get a good deal on the vaccine, and we need the world to get a good deal on it. And there are many of the companies have committed themselves to that.
Mm-hmm. The Gates Foundation is one of the largest funders of vaccine research in the world. Vaccines save millions and millions of people around the world every year. Are you concerned about a growing anti-vaccination disinformation campaign that exists on social media?
Yeah, it's always a concern because vaccines are so key to keeping measles deaths down. Vaccines helped us eradicate polio. Vaccines are so important. They've played the primary role in cutting child to death in half over the last 20 years. That our foundation, the U.S. government have been very involved in that. So explaining how careful we are about vaccine safety is super important. During a pandemic, I can understand people's anxieties levels going up, but explaining what the testing is doing, we will need a lot of people to be willing to take the vaccine to stop the transmission.
You have been the subject of a disinformation campaign. In fact, the posts on social media about you and coronavirus are considered the most widespread coronavirus falsehoods that exist. So I want to address some of them. To be clear, do you want a vaccine so that you can implant microchips into people?
No, there's no connection between any of these vaccines and any tracking type thing at all. I don't know where that came from.
And yet there was a poll by YouGov and Yahoo that shows 44% of Republicans, 19% of Democrats, and 24% of independents think that you want to do that. How did this conspiracy start?
I don't know. Dr. Fauci and I are sort of the two most mentioned, and some of these are deeply ironic, like, our foundation is about reducing death and, bringing equity to health, and yet the idea that, we get accused of creating, chips or the virus, I think we just need to get the truth out there. We need to explain our values so that people understand why we're involved in this work and why we're willing to put hundreds or billions to accelerate the progress. It's a little unclear to me, but I hope it'll die down as people get the facts.
I know, but I want to ask you this because you're a co-founder of Microsoft. You travel in the circles of many of these tech leaders who control these companies. I know you know them. There was a Facebook post with that widely debunked conspiracy theory that says that you want to do that. It was shared tens of thousands of times. It's still on Facebook. And I reached out to Sheryl Sandberg today about it. Facebook has told me that they will send it to review about whether to take it down. Does Facebook have a responsibility to do more in terms of shutting down this misinformation?
Yeah, well, they are willing to get rid of anti-vaccination messages that are, false there. And, so there's a constant dialogue about, okay, how do they make sure that these completely false things don't get out there? You don't want to suppress, normal dialogue about safety studies, but the conspiracy theories, they, are starting to step up on, and, we feel like we have a good dialogue with them about how to do that.
I want to ask you about what appears to be a growing testing crisis in America with long lag times in order to get test results back, especially in Sunbelt states. Most of the tests to date have been PCR tests and the nasal swab tests. Where are we in terms of a rapid diagnostic test? You've talked about this a lot. It would be a test that is like an in-home pregnancy test. Where are those tests?
In the next 2 to 4 months, some of those tests will get approved. Now, they won't be as accurate as the PCR, which is a molecular test. And so over the next few months, we have to up PCR capacity. We have to get results back in 24 hours as we roll out the paper test. We need both. And the lag times that we have today are completely unacceptable. It's making most of our tests pretty much worthless.
You've written that this is like a world war, that it's us against the virus, essentially, and we all need to be on the same side. I have a question about whether we are all on the same side, because yesterday the FBI charged 2 Chinese spies with trying to steal U.S. vaccine research. Is China on our side?
Well, certainly China is working on vaccines. You know, these are not like military weapons. There's going to be broad understanding of how these vaccines are made and tested. All the data is, filed, so people can understand the results. So it's strange. It doesn't make sense to me. There's really no deep trade secret thing there. The Chinese vaccines aren't as far along as the European and U.S. vaccines, but yes, I think we all want to bring this pandemic to an end.
Bill Gates, thank you so much for joining us and for all of the information. We appreciate it.
You bet. Thank you.